Great. It's over to you when you're ready.
Right. Okay. Perfect. Well, just to reintroduce myself, my name is Aubree Worobetz. I'm a Year 3 medical student at UL. And in this presentation, what I'm going to talk about is the Medwell Program, which is an exercise intervention. And what this research did is compare the Medwell Program to an existing mindfulness program in a medical school curriculum. So just a little bit of background about why this research kind of came about. There is a concern for mental health in that of university level students, and this research was carried out before COVID, but that's become even more apparent over the last year or so with COVID and everything. Medical programs in particular challenge the mental and physical health of their students. It's been well shown that medical students have higher levels of anxiety, suicidal ideation, depression, and loneliness. So in kind of a similar aspect, there is exercise, which has also been well researched. And in that of medical students, it's shown to have really beneficial effects mentally and physically. It's shown to lower stress, lower levels of depression, and just be a really good mode for mental and physical health overall. Similarly, kind of in the medical perspective, patients have been shown to have huge benefits from exercise. When you look at chronic diseases like heart disease, there's type 2 diabetes, hypertension, there's loads of them out there that exercise has really been shown to have a really great effect on. And more generally speaking, there's benefits of exercise really with everybody. And I put this link into the slide there of a really great YouTube video, which I referenced in my last presentation. And it essentially boils down to the importance of getting out and exercising at least 30 minutes a day and the effect that it can have on, everyday individuals. So this brings us to the Medwell Program. And what it is an exercise intervention that's specifically designed for medical students. So what it is 8 weekly sessions. Each of those sessions is 2 hours long with an hour of exercise, and then each is prefaced by about 30 minutes of an educational talk. So most of these lectures surround the idea of how to prescribe exercise as medicine. So here you can see just kind of a rundown of what each week looks like. Lots of different types of exercise, from yoga to Pilates to boxing. And similarly, the lecture that happens beforehand varies every week. So it keeps people engaged, it keeps it varied, and keeps it interesting. So looking at the study design and analysis of the Medwell Program. So in a previous study, the Medwell Program was proven to be feasible and acceptable. And as a result, it was integrated into the curriculum for all Year 2 medical students, which was really exciting. That curriculum already had a mindfulness program as a part of it. And mindfulness has also been shown to reduce stress and improve mental health. So there was a really unique opportunity that presented itself to compare the Medwell Program to the mindfulness program. And that's exactly what we did in this research. So what we did was a non-randomized control trial. We took all Year 2 medical students and we divided them into half participating in the exercise program, Medwell, and the other half in mindfulness. And it was non-randomized, meaning that people could choose which group they wanted to participate in. So each program ran for 2 hours a week for 8 weeks, and we looked at participants before and after by using questionnaires. So these questionnaires asked a variety of questions on different topics, such as their overall health and well-being, their sleep, their loneliness, but also things like how often they exercise during the week, their weekly step count, and how confident they felt in prescribing exercise to patients or future patients. So looking at the results here, so we distributed the questionnaires before and after, and then we looked at what people said. And so 107 of the 140 people completed both before and after questionnaires. And we looked at it in twofold. One was that we looked at each group separately. So we looked at people just in Medwell before and after, and people in mindfulness before and after. And then the second part of the analysis was comparing Medwell versus mindfulness. Great. So this is a bit of a wordy slide with a lot of numbers on it, but there's really 3 columns that you kind of want to focus on. The first is the one on the left, which tells you which outcome measure we're focusing on. So, you know, the scales of loneliness, their scales of sleep, or how often they exercise during the week. And then the last 2 columns tell us if the differences that we found were actually statistically significant. So what we're looking for in these 2 columns is a value that's less than 0.05, because we use what's called a 5% level of significance. So if we look at the column on the right, that is the values that look at the Medwell group versus the mindfulness group. So was there actually a difference between people who did Medwell and people who did mindfulness? And you can see none of these are actually less than 0.05. So it turns out there wasn't actually a big difference. But then similarly, if you look in the second last column, so what that one does is actually compare within groups. So did somebody who started Medwell finish off better than they started? And you'll see there's a few values there that are actually greater than 0.05. Both groups improved in overall health and well-being, as well as in sleep, whereas just the Medwell group improved in weekly levels of exercise and in their confidence in prescribing exercise. So that was exciting because there were some statistically significant improvements. So this is actually kind of a nicer way to envision what that last chart said. So you have the intervention group on the left, and we know that they alone improved in their weekly levels of exercise and their confidence in prescribing exercise, whereas both groups together improved in their health and well-being and sleep quality. And you can see on the right side that control group didn't improve in any topic on their own, if that makes sense. So what conclusion can we draw? We have all this data and we've seen there's some improvements here and maybe not some improvements with the mindfulness group. So what conclusions can we actually draw from that? Well, we can say that there are statistically significant improvements within groups. So that's the Venn diagram we just looked at, the weekly exercise and the confidence in prescribing exercise in the Medwell group. And then, of course, in both groups, in the overall well-being and sleep quality. However, we can also conclude that there's no significant differences between groups. And that can be attributed to the fact that both groups actually increased. So a nice analogy is actually if you got 70% on an exam and so did your friend, and then you both studied and you got 90%, well, you might look at it and say that you didn't change, but that's because you both improved. So you're still on the same level, but both of you got better. And that's essentially what happened in this research. So this actually does align with other research on exercise and mindfulness that shows that they both have a really positive impact on mental health and well-being, which is a really good thing in the end. And so what does that mean for the Medwell program in particular? Well, it means that it will remain in the Year 2 curriculum for all medical students. And really what it's giving is an alternative. Before the Medwell program, all students were required to participate in mindfulness. But now with the Medwell program proving through this research that it has equivalent improvements, students can have the choice because mindfulness may not be appropriate for everybody. And alternatively, an exercise program might not be in favor for all the other students. So that was it. That was the presentation. I'll take any questions if any of you have any. But yeah, thanks for listening.